It's another day here at the stroke unit at the Kolebu Teaching Hospital. At least I can count 8 patients on admission, some with severe forms of a condition requiring critical care. Principal Nursing Officer Monica Nanwa Apia is on duty today. She's helping some patients feed.
Somebody will have stroke, the person may be unconscious, the person may not be able to talk, the person may not be able to swallow, the person may not be able to walk, the person is incontinent. So basically, nurses do all the activities of daily living for the patient.
I am told something as basic as turning in bed is impossible in some of the worst affected patients.
Bath them, changing their diapers, treating their pressure areas, because when you lie at one place for a long time, you end up getting bed sore. So we do regular turning of patients in bed.
The youngest patient here is only 22 years, but there are others who are older. Monica and her colleagues have to cater for them all based on their specific needs.
And sometimes some people have been diagnosed with hypertension, but they are not compliant on their medication. They are not taking their drugs well. Some people have been diagnosed with diabetes. They are also not being compliant on medication. They are not taking their drugs well to control their diabetes and their hypertension. So they all have a risk of getting stroke.
Even at the height of the COVID-19 pandemic in Ghana, these nurses and other health workers were here to assist patients on admission.
We were the only people who have to be at work. Despite the fact that there is COVID, people still come down with stroke. So we have a lot of cases. So we're coming to work every day to take care of our patients. And the challenges is we don't even know who has COVID and who don't have COVID.
And while the nurses are at it, the doctors and other medics also help through the rehabilitation process. Physician specialist and one of the doctors here, Dr. David Brodimens, wants people to guard against obesity.
When you have a lot of what we call central obesity, that is the pot bellies, the weight around these areas, like so many of our Ghanaian men have, it tends to increase your risk for stroke as well. Okay, so know your weight, know your height. If your weight is too much for your height, you have a BMI of either 25 and above, your risk for stroke is higher.
For dietitian Andrew Pabi, controlling what we eat can go a long way to reduce the risks of getting a stroke.
Some foods, when taken in excess, it can make your weight go up and this can affect your blood pressure. But generally, people who eat outside, all right, they eat meals prepared from outside and are hypertensive, generally it's likely that the outside food has lots of salt in it or has some ingredients which are not so wholesome for the patients. Yes. Such patients will recommend that they eat foods prepared at home.
Monica Nanwa Apia and her colleagues have this message for Ghanaians.
We are saying join the movement. It's more of physical activity, exercise. And we also say that we have to identify our conditions that we have, especially if you are a diabetic, you have to control your sugar by taking your drugs regularly. If you are hypertensive, you have to be taking your antihypertensives regularly. If we are depressed or we are stressed up, we need to make time to rest so that the body will be fit and then we'll stay away from getting stroke.
Komla Adum, TV3 News, Accra.